Hello and welcome to the overview of Rwanda's healthcare system. This project is presented by Abdoulaye Farah, Ndaye Songo, and Robert Mugire. Rwanda is a Central African republic with a population of 12 million people. It shares border with Uganda, Burundi, Tanzania, and the Democratic Republic of Congo, formerly known as Zaire. Rwanda is best known for its dark history and the genocide of 1994, where nearly 1 million people have died in the course of a few months. However, what is so remarkable is not only the resilience of the Rwandan people to overcome such impossible tragedy, but also going far and beyond to become one of the most promising economies in the sub-Saharan Africa. The history of healthcare in Rwanda begins with the German and Belgian colonial era. Both the German and the Belgian colonists haven't spent that much time in improving the health of the Rwandan people during their colonial era in Rwanda. That's why they haven't left that much healthcare infrastructure prior to their departure in the summer of 1962. Healthcare in post-colonial Rwanda was almost non-existent, with the majority of Rwandans relying on traditional healing practices, limiting access to modern medicine to the leadership elite and the wealthy few. One of the biggest healthcare themes in Rwanda's healthcare prior to the genocide was the adoption of the Bamako Initiative. In the fall of 1987, UNICEF and World Health Organization co-sponsored the Bamako Initiative, with which 33 health ministries from sub-Saharan Africa, Asia, and Latin America have signed one of the biggest healthcare pacts ever been sponsored by the United Nations. Rwanda was one of the signatories and beneficiaries of such agreement. The main theme of this agreement was increasing the accessibility of healthcare through the community-based reform and decentralizing healthcare delivery and decision-making process. Before the war erupted in 1994, the government was en route to implement some of the elements of that agreement. Picking up the pieces following a brutal civil war, Rwanda's healthcare system had to rebuild from the ashes of the war. Healthcare centers and few hospitals around Kigali began to offer free healthcare services to Rwandan nationals. However, realizing the need for a more comprehensive and pragmatic approach, the government introduced the user fees in late of 1994 to enhance the quality of care. Nevertheless, the need for national policy and strategy surfaced in 2001 following the finding of a report that have shown almost a non-functional healthcare system in Rwanda. To revolutionize the health industry, the government therefore introduced what it called the Community-Based Health Insurance, CBHI in short. This system has three main principles. First is the prevention of infectious disease. Second was the medical care through voluntary prepaid health insurance, and finally, performance-based financing of the healthcare. Under this new plan, the government would subsidize all preventative care for all Rwandan nationals. However, the curative care was not fully covered in this plan. To compensate such gap, the government introduced the Mutuelle de Santé plan, which funds the local non-governmental healthcare organizations to offer curative services for all Rwandan nationals employed outside of the public sector. To pay for the Mutuelle de Santé plan, the government made an agreement with local NGOs to offer clients with an affordable premiums, while the government comes up with the rest 50% through the support of external donors, international organizations, and other well-wishers. This system structures the healthcare system in Rwanda into three main levels. The sector level, which serves about 50,000 people, the district level, which comprises about 5 different sectors, and the national level, serving for all 10 districts of Rwanda. Some of the biggest changes recently was the financial restructuring of the CPHI. In 2010, Rwanda's Ministry of Finance and Economic Planning have created a subset called Rwanda's Social and Security Board, RSSB. The objective of creating this new department was to take charge of the CPHI's financial burden away from the Ministry of Health in order to integrate the healthcare need into the financial institutions of Rwanda. The integration was proposed in 2014 and has been implemented in the summer of 2015. Even though the government offered all nationals a universal healthcare, strictly in the preventative front, yet Rwanda had to find a solution in paying the treatment phase of care. That's why the government subcontracted local NGOs and independent insurers to provide affordable premiums, with 50% already covered under the contract. Some of the packages available to consumers in Rwanda is the primary care offered at the local clinics, the secondary care offered at the district level, and the tertiary care offered at all nationally recognized 7 hospitals in Rwanda who have services that are not available in the previous 2. One of the biggest themes and the features of Rwanda's current healthcare system is the assimilation of the social justice principle into the CPHI program. In Rwanda, regardless of your socioeconomic status, everyone who lives in Rwanda qualifies to be covered without any preconditions under the CPHI. And this was a win-win situation for the Rwandan nationalists who struggled to make the ends meet. Over the past decade, Rwanda has made quite tremendous improvement in various key health indicators, such as in the domain of child and maternal health, where the estimates of maternal mortality ratio decreased from 1,071 deaths per 100,000 life paths in 2000 to 476 deaths per 100,000 life paths in 2010. Another example also depicted on the table above is a significant decrease in the infant mortality rate from 50 deaths per 1,000 life paths in 2010 to only 28 deaths per 1,000 life paths in 2015. In 2013, the total healthcare cost per capita was reported to be $162, and the government spent about $95 for each person on healthcare. This is remarkably lower compared to that of the United States, which was over $10,000 in that very same year. There has been substantial economic growth in the gross domestic product of post-genocide Rwanda. The total GDP for Rwanda was reported to be $9.14 billion in 2017, which is 0.01% of the world's economy. After the 1994 genocide, health expenditures share in the national budget started to increase, and between 1999 to 2000, this share reached 4%, which is comparable to around 3.5 billion Rwandan francs, or about $1.25 per person in the nation. In relation to the national economy, only 0.6% of the GDP is dedicated to healthcare expenses and services. Some of the weaknesses of the Rwandan healthcare system is a lack of alternative funding to manage HIV programs, 80% of which were funded initially through external donors. Also, the patient's privacy are compromised, particularly by the healthcare employees who happen to share patient information through their private cell phones. On the other hand, disease prevention and control services are not yet readily established in Rwanda. Rwanda also has to address the issue of healthcare accessibility by some marginalized communities inside Rwanda. Finally, the Rwandan system lacks the needed coordination with other developmental sectors of the economy in order to fight malnutrition and food insecurity. Unlike most sub-Saharan African nations, Rwanda's strong commitment to an integrated response to HIV has greatly improved the health of its people as a result of the universal health care coverage currently in place in Rwanda. Despite the fact that Rwanda is a developing country, it does provide 90% of its people adequate health care. In this sense, Rwanda even surprises much bigger economy and more powerful nations like the United States, who fails to offer similar services to all its nationals. However, a downside for Rwanda's healthcare is a lack of sufficient patient privacy protection laws in order to safeguard individual rights to confidentiality. It is not a secret in Rwanda that healthcare employees do share confidential patient information over their cell phones. CPHI is quite popular in Rwanda with over 90% registration. The people of Rwanda appreciate the efforts and the extraordinary achievement of their government to restore a reliable and cost-effective healthcare for all Rwandan citizens. In conclusion, as a small nation trying to break free from the shackles of social, political, and economic uncertainties that have retarded the overall growth of the Central African region, Rwanda demonstrates the powerful possibility of hope and aspiration in the face of a limiting fear. The country's ambitious healthcare agenda have not only surprised other countries in the region, but also other nations around the world. It is evident that the healthcare achievement in Rwanda is a living testimony of the potential of a powerful will that's determined to change the course of history in one of the most socioeconomically volatile regions in the world. That being said, Rwanda has still a long way to go in order to assure the sustainability and the continuation of the current healthcare system. Thank you.